Hey students, it's Professor Wagner here, getting ready for your Chapter 1 for Professional Behaviors. So the objectives today here, we're going to talk about respect and how it's earned, how is value defined, what are professional values, and what is an integrated value system. So the first question I want to ask you is, what is respect? How would you define respect? Is it something that's earned? Is it something that you have to work towards? How exactly do you define respect? The book talks about how it's defined as basically you matter. The respect you show to another person is a reflection, ultimately is a reflection of your willingness to look past positive or negative attributes to the very core of what the person does. So what does that's a lot of words, but what does it mean to you? You are worth the trouble. And when talking to your patients or coworkers, being able to show them the respect that they deserve, whether you agree with what they're talking about or not. There is a thing called dignity, and if you define dignity, it's a sense of pride in oneself. And there's also an inherent dignity that distinguishes us from each other's, which each person has their own kind of sense. We're all individuals in this world and we all think of ourselves differently, and it's a matter of being able to recognize that in each person. If we think about persons to help emphasize that it resides beyond the physical, social, or psychological characteristics that distinguish us from each other is also another definition of dignity. The next slide talks about respect and kind of gives us a little general definition, but at work, we treat each other as we would like to be treated. We value and learn from the strength of our diversity. We actively listen to others, and we recognize that everyone has a contribution to make. So understanding again that this isn't just with the patients that you're working with or the family or the caregivers. This is also the people that you're working with day in and day out, whether it's the doctors, the nurses, the OTAs, other PTAs, whoever, and we need to be able to ensure that we are treating others past even the most unlikable attributes. Thinking about what's an unlikable attribute? Think about who you're treating with. If we think about our patients, they are in a lot of pain at times coming into your facility. They're not going to be chippy and cheery every time they walk in. They're going to be uncomfortable. They might be crabby. And you're going to have to treat them with the respect that they deserve, even past what they're presenting to you. So what are values? Or true values for that matter? Values are things that we hold dear. Again, everyone's values are going to be different. A true value is something that becomes part of a pattern of a person's life. So object used for their usefulness, their beauty, or power to evoke a memory or meaning. And again, a true value is an object used for their usefulness, beauty, or power to evoke a memory or meaning. For me, I would say that a true value, I have a ring from my Grammy who passed away 6 years ago. That's something that I value because that evokes a memory or a meaning for me. It reminds me of my Grammy, and it reminds me of when she was alive. Values come from different sources. They're either taught, reinforced, and internalized. So again, it's not just the same for every single person who walks in your door or who you work with. These values can change over time, and they change with us when we grow up. A value for a 5-year-old isn't going to be the same as a value for a 60-year-old. Those values are going to change with time as you grow and as you learn what's important to you. So we might value responsibility, inclusivity, respect, social justice. There are many different things that we can value on our own through our through what we've learned, through our family, through how we've grown, things we've experienced. Those values are going to change with time. There are personal and professional values. Your personal values are strictly your own values, no one else's. It allows you to place worth on actions or objects for personal satisfaction. Again, these are only yours and can only be yours. No one else's. It's what you value the most in this time in your life right now. Today is your personal values. There are also professional values. And these are embracing values that are consistent with being a professional means and whatever your practice entails. Sometimes your practice, we have a code of ethics that we have to follow, right? I know we've looked at these in fundamentals. Standards of ethical conduct for the PTA. Respect the inherent dignity and rights of all individuals. We demonstrate integrity in our relationships. We make sound decisions and collaborations. Those are professional values that we're talking about. And then being able to exercise wise judgment consistent with that area of knowledge and expertise. A lot of times you're going to find that your personal values and your professional values can overlap, and they will overlap. There will be a lot of things that you're going to find professionally that you hold true to your own personal values as well. That's okay. Now, I know that this slide shows our vision, but our vision has recently changed, and I haven't had an opportunity to update the slide here. But our mission currently reads, CPC, Central Penn College opens opportunities to students from a variety of academic backgrounds by providing the education needed for employment and advancement in their fields. Our vision then says to become a leading resource for professional education in the Central PA region and beyond. You're going to find that, or should find that, your facility that you work in will have a mission and a vision in what they want to see in their own facility. It's important that you understand that mission and vision and that follows where you want to go with your own mission and vision. It will be different for every company. Usually they sort of read the same way. But if there's something that isn't following your own value system and that facility is a little bit different than what you're looking at for yourself personally, then that's something that you might want to think about and change up a little bit. So societal values. I'm not sure I missed anything on here, but societal values, well, first of all, what is a society? It's determined by your family and where you live. Right now, it's Harrisburg, PA for me. What does the society actually value? And that's determined at where you are right now. This Harrisburg, PA might be different than New York City. And I mean, we're talking, things are changing right now with the virus that's happening. But anytime a person is placed in a position in which it's impossible for that person to live up to society's expectations, he or she may experience anxiety and discomfort. So let's think about that. I will give an example for right now, to this week actually. For me, I've had society is showing that I should be able to work full-time, be a full-time mom, work full-time, teach full-time, and go to bed okay and sleep 8 hours. It's not physically possible. And I experience this anxiety because I'm looking at it on Facebook and Instagram, and I see these families who are doing craft after craft and baking and taking their kids out for walks every day and learning and doing learning activities like workbooks and letters and throwing words into baskets. I can't do it. It's not possible for me. I'm exhausted. And to me, that society right now is saying that I should be able to do all of these things without an issue, and I'm not living up to those standards, which is causing me anxiety. And that's just a personal example. For you guys, it's a tough time, but we just have to figure out our own normal, I guess you would say. I think the society values have changed a lot with the times now too, because we have more access to web, radio, and TV, and we're kind of part of a global society. These things that we're reading about in China and Australia, we're getting access to it immediately. We can see it immediately, and that's increasing what we feel our society needs and what they want. You're going to also hear about primary goods. These goods are supposed to be desirable for every human being and also useful for them. And there's two different categories. There's the social primary goods and natural primary goods. The social primary goods are your rights, liberties, powers, income, wealth. And then the natural ones are your health, vigor, intelligence, and imagination. The natural ones are going to come naturally. The social ones are for everyone. So if we talk about that, good life and you. So again, these three sets of values, your personal, professional, and societal. Go over in your head right now, what exactly is a personal value? And list an example. What's a professional value? And list an example. And then what's a societal value? And list an example. Again, these values can overlap, and they will each and every day, depending on where you are, how they've changed, and where you are in your life right now. This slide says, with healthcare professionals, a disconnect can occur when professional values comes into conflict with personal values. How do you think that would be? What do you think would happen? If you're not conforming to those, quote, norms, it can be uncomfortable. If you have tattoos up your arm and that's something that you value but not something that your patient values, that can be sort of uncomfortable if you're being treated differently. It sort of all circles back to this respect that we've talked about at the beginning, that everyone deserves the same amount of respect as someone else in this room. Respecting for changes in values. Again, one way to show respect is to find out more about that person. You'll find that I talk a lot. And when I'm in my clinic and I'm treating my patients, I'm going to initially talk about their pain and where it is and how it hurts and what makes it better or worse. But after that, I'm talking to my patient about them. Where are they from? What do they do? What do you enjoy doing? Did you go to the Hershey Bears this weekend? What'd you do on your social distancing? What kind of Netflix shows are you catching up on? Those kind of things are what I'm going to be talking to my patient about. And the more that I can integrate my patient and kind of learn about them, the more respect I'm showing for them. And then also remember, everyone's values change at times, and especially when you have a patient with a long-term illness. A patient who might have found work to be very valuable to them, but they can't work anymore because of a cancer diagnosis, or they had a spinal cord injury. These values might change, and they might value family a little bit more than their work. It is our job to kind of guide them through their diagnosis and help them with these new identities or these new interests. You'll have a lot of patients who are getting older who used to run every single day, and they can't run anymore because of a back injury. It's your job to kind of help them through that and find a new normal for them. And remember that attitude and respect involves both attitude and behavior. So it's not just your attitude towards the issue, it's how you behave towards the issue. All right, guys, so that is chapter 1. If you have any questions, please feel free to email me. I'm happy to help. I will be putting up a discussion board for week 1. It might have a few different questions, so make sure that you are answering all of the questions. And again, if you need anything, please let me know. Thank you. Bye.